You're very welcome back to the programme. Well, now it's Ash Wednesday and it's National No Smoking Day. Traditionally, it's the day that many will attempt to give up the habit. Well, this year, pharmacists are getting involved in helping people to do so. And I'm joined now by Maher, who's Vice President of the Pharmacy Union. Kathy, thank you very much indeed for coming into us. So what exactly are pharmacies going to be doing here in terms of smoking?
Well, Minister James Riley has launched this service today in conjunction with the HSE, Healthy Ireland, with the support of the Irish Cancer Society. So it's a really exciting service, a huge initiative for patients to come in and seek pharmacist support. Patients are more likely...
So you're going to see these posters in pharmacies?
These leaflets are around. Patients are more likely to come in and quit and stay quit when they have the support of a healthcare professional.
Right, and that's what research is already saying, yeah?
Research everywhere is showing it. And the most accessible healthcare professional there is the pharmacist. The pharmacist is in every community, they're in every high street. You can go in, they've extended hours, 6-7 days a week, so the pharmacist is there.
So what are you saying to smokers now who may be watching? I'm looking at, these are the booklets you're going to be giving out. A smoking diary, first of all. So,
well, if someone approaches a pharmacist, and pharmacists are very skilled both in pharmaceutical knowledge but also in their questioning skills, their counselling skills. So if someone approaches the pharmacist, we will determine what stage of the change cycle are they at? Are they ready to quit? Are they contemplating quitting? Have they perhaps picked up a prescription for a family member that's had a heart attack and we know that patient is smoking?
It's a good time to get at them then,
at all those points. So once the patient has decided that they're ready to quit, that's the first stage. So we will come in and we'll set a quit date. We won't just start tomorrow, we'll set a quit date. You go off, you have a think why you enjoy smoking, what reasons you smoke for, and how can we address those reasons. The more preparation and time that they invest in themselves with the support of their pharmacist, the more likely that they're going to stay off the cigarettes.
That's interesting. And I mean, I remember talking to Luke Clancy years ago, the respiratory physician. He was saying giving up smoking is a procedure. It will take a certain number of attempts before you get to the final attempt. Is that what the evidence said?
For those that successfully quit, they will have tried at least 3 to 4 times before. And we urge patients not to think of that as failure. It's just in the change.
It's part of the road to getting off the fence.
They may not have been mentally ready, they may have used the incorrect procedures, the incorrect products, and they may not have had the support. Yeah. So what this service is doing is giving patients support. We start with the initial consultation, then we follow through to the quit date, and then we follow up on a weekly basis for the first 4 weeks, then in month 1, then month 2, then month 6. And we'll also have a service, if you're having a difficult day, get in touch with your pharmacy, reach out for help and support, rather than reaching for a
almost
cigarette.
Like a kind of a Weight Watchers system, you know, that there's somebody there who's monitoring you, who's up for you. Will you also, I suppose, you'd advise them on any nicotine replacement therapies that they may or may not want to use?
Well, that's it, and you've hit the nail on the head. It's patient preference as well. We're not out there to sell nicotine replacement. It's to go through what they've used before, what has succeeded, what's failed, what their preference is. They may need referred to the GP, we may need to refer them to the HSE quit line, but ultimately it comes down to the patient support from their pharmacist and the service.
Kathy, can I ask you, I mean, it's all part of a much bigger drive to get the pharmacist to have a much more integral role, if you like, in the health service. I mean, just talk to me about that. You're very highly trained professionals, and yet you're not really at the patient interface that much.
Well, I suppose we're at the patient interface in that we deal with patients. I mean, even with smokers, we deal with their health problems all day, every day. But there's lots more that we can do. We can provide other services such as minor ailment scheme that patients can come to the pharmacy, access certain medicines without the need for the 3 to 4 day wait with the GP. And that also frees up GP time to deal with more complex patients, the ones that need serious referral to A&E. A recent study had shown that 1 in 7 patients that attended A&E in the UK could have been dealt with very effectively in the community pharmacy setting. So obviously that frees up
1 in 7 could have been dealt with by a pharmacist. That's incredible, the potential there for impact.
Exactly. There are other things such as medicines use review. We could take patients that are on multiple medications that maybe aren't complying if they're not taking their medicines properly. Their disease or the condition isn't being treated. So we take them in, have a 20 to 40 minute consultation with them. We can go through what the medicine is for, what we're being used to treat and what their treatment goal is. They're more likely to comply with their treatment regimen if they know why they're doing it.
And I suppose pharmacists are more likely to have the time for those longer consultations than busy GPs or indeed emergency departments would have.
They are to a certain degree, and pharmacists are hard pressed in terms of staff and resource and that as well. So that's why anything that happens at the minute is kind of ad hoc. We need these to be structured services in conjunction with the HSE to save money in the long term.
And when you say structured, what do you mean?
Well, if I'm going to spend 20 to 40 minutes in my consultation area with a patient, I need another pharmacist to do prescriptions, to do the OTC advice. So we need structured services that we can provide these services.
So there would be a cost to the state for the pharmacist to step up and provide more services?
But the cost is in the short term to save money in the long term.
Have you quantified the figure at all? Or?
We have. I don't have it to hand, but the evidence is there to clarify it.
So that's under negotiation.
Exactly.
So we'll come back to smoking for the moment. It is No Smoking Day. What's the first advice you would have for anyone watching here who's thinking of it?
Contemplating it, go in and seek the advice of the pharmacist. Set a quit date. Don't be quick about setting your quit date. Don't say, I'll do it tomorrow. We'll set the date, we'll work towards it, and seek the advice and support of the pharmacist.
And do you reduce coming up to the date? Do you try and do that, or is it a...
No, I would say to the patient, enjoy it for the next few days, because on Wednesday, on Friday, this is your quit date. We will speak to you and we'll come in on the quit date.
OK, and is every pharmacist in the country participating, or every pharmacy?
Every pharmacist is doing this on a daily basis. Now this is the service to launch it. OK, great. Well, listen, and there's all kinds of details there. We've got the quit line. We're looking there, 1800 201 203, and indeed the Facebook site, that's HSE Quit, and quit.ie. So more advice on all of those. Absolutely, and it's never too late to quit.
Super. Listen, Kathy, thank you very much indeed for coming into us this morning. Now, it is just 10 o'clock on Wednesday morning. Still to come today, we will have the latest news in just a moment. Then we're going to be speaking